Hey friends, welcome back to Yoga for Dentists. I'm your host, Dr. Josie DeVideo, longtime dentist, certified yoga teacher. Today I'm chatting with Dr. Sonia Chopra, who is a board certified endodontist in North Carolina. In addition to being a dental speaker and authoring journal articles, she is the founder of eSchool, an innovative online continuing education course in endodontics, and it's trained hundreds of general dentists and empowered endodontists to run better practices and perform better root canals. So, Dr. Chopra, welcome to the show.
Thank you for having me, Josie. It's really a pleasure to be here with you.
So, I'm going to confess to you that I always found endo very, very stressful. And it wasn't so much the fact of the procedure itself, but troubleshooting post-op sensitivity, making sure my diagnosis was correct. In other words, the technical part is one thing that presents its own set of challenges, but everything that surrounded endodontics for me was very stressful. So I ultimately just ended up referring all my endos out, unless it was a slam dunk, which I don't know that those really exist.
They don't exist.
So, I've been fascinated by your eSchool because if I would have had that early in my career, I think I would have reduced my level of stress significantly because your program is very well thought out. It's almost like taking everything we learned in dental school, filling in the gaps, simplifying it so that everybody can feel more comfortable doing endo. And so I just love eSchool, and I wanted to have you on because I figured you are the expert to share with our audience ways to make endo less stressful for people. So, what do you have to say about that?
Well, first of all, you're not alone with that feeling and that emotion about endo. I feel like that is so widespread. And I think a lot of that has to do with how it's taught in dental school. Endo is so important when it comes to dentistry because 80% of our patients are seeking us out because they're in pain, right?
Yes.
And endo is all about diagnosing pain and treating pain. So if we're not really proficient at it, we are not going to feel good at it, right? And so that creates this level of stress that, quite honestly, it's really unfair. If I could go back in time or just change the world, or if I was president, I would want to change the way endo is taught in dental school because it's really, in my opinion, the basis of dentistry.
Yes.
And so that everybody shares the sentiment about stressful endodontics, and it doesn't have to be because it's just like anything else in your practice. It just needs some really easy, simple systems that you can implement. And when you understand the diagnosis and then you have a system for your diagnosis, then that sets the stage for your system for pain management. And then that sets the stage for the treatment part. And then that sets the stage for the post-operative part. And so it's all linked together. And then when you can understand how one is the foundation for the next, and each thing kind of builds upon the previous part, then it makes sense. But endo it's about the details and it's about practice. And so I think a lot of people also have to give themselves that space to practice and allow themselves to make a mistake and use that as a lesson for the next patient. It's not an easy thing to do, but again, with the right systems in place, you can really make it less stressful.
Yeah, and I think you hit the nail on the head because I was going through dental school during a time where all the new rotary systems were coming out. Okay, so I learned hand filing and there was no rotary anything, like just the handpiece to get the access opening. So in that part of my career, all the rotaries were coming out, which I loved the idea of the rotary system, but then every company developed their own. And so then it became like, there are too many systems now and there's too many ways. The marketing of the rotary endodontics became overwhelming when really the dental schools could have done a better job focusing on the basics of endo. The basics don't change,
Yeah, they don't.
but how we do the procedure changes because of the rotary, but the basics don't change. So yes, I think it predominantly is a lack of systems, but you don't know what you don't know, right? And so
Right.
we're being It's kind of like, we're initially taught in treatment planning, you really have to get the health history and you really have to understand dental history and all this stuff. And we just kind of gloss over that at some point in our careers because we just want to get to doing the procedure. And I feel like a lot of people who attempt endo do that as well. They just want to get to the root canal because they got to finish that to do the crown, the core buildup and crown because they only have an hour and a half and yada yada. So, but from what I'm learning through your e-school emails that I get, is if you don't have the right diagnosis, you're going to open
Mm,
up a can of worms.
correct. It all starts with your diagnosis. The diagnosis sets the stage for how you anesthetize your patient, how you treat your patient, how you medicate your patient. And when I say treat your patient, I mean, like, let's say you have a limited amount of time in your schedule. You need to know what is the minimum amount of treatment you need to do to get your patient out of pain and stay out of pain and love you for doing it. Right.
Right.
So your diagnosis, once you know what that is, that's actually where the recipe is. It tells you exactly what you need to do. And then you also know in the postoperative period, like, are they feeling normal? Are they going through the normal symptoms after the treatment? And if you don't know that, then you're going to, again, bring stress into your life. So that's the missing link in the way that I feel like we need that transition from going from a didactic education to a real world clinical experience. And unfortunately, when we come out of school, you're right, it's the system, it's the companies that are putting on all the CE because they want you to buy this system. And then we get confused in that messiness of what do we purchase when actually, like, it doesn't matter.
Right.
Right. The number one question people ask me is like, what rotary file system do you use? Who cares? They all do the same thing. They're all cutting dentin.
Right.
It's just, you need to understand what's the shape that it's creating. Because if you don't know what shape you just created, you're not going to know how to fill it. So there's
Right.
no one system that's superior to the next. You just need to know what it's doing for you. And that's where people kind of lack that education because they're simply, it's not given to them.
Right.
So that's the piece that this fulfills. That's the void that we're trying to fill with this type of education.
Yeah, absolutely. Because if somebody broke it down like, on a cooking show, they're like, you need salt, you need fat, you need, like if someone just gave us that, and then like you
Yeah.
said, any other way, the way to accomplish that varies depending on who your sales rep is and who brings you donuts. But the basics of getting the procedure done is what really needs to be spelled out. And that's what I think eSchool does a great job at. Now, I am really curious about how you ended up wanting to be an endodontist because that to me is just like insanity. So tell us a little bit about your journey with that.
Well, it all started kind of when I was born because I was born without 8 teeth. And so my mom, the summer after I graduated high school, which was 1995, she said, I want you to go to college with a full set of teeth because I was missing my second mandibular bicuspids. And she didn't like the fact that I wasn't fully in function. So my summer experience was graduation parties and then going to the dentist. Like once a week, I had an appointment and I got 2 bridges on each side, or one on each side. And soon after, I started getting a toothache. And I was very vague. I really couldn't tell you where the toothache was coming from. All I knew it was on the lower left side. I went to the dentist. The dentist had no idea. He took an x-ray. He kind of sprayed some air on my tooth and couldn't give me an answer. So said, sorry, come back when it gets a little worse. Well, this kind of went back and forth for several months, about 9 months, because I actually ended up going to college and then I ended up swelling up because the infection stayed there for so long. I actually
Right.
got a bored hard cellulitis. I lost like the border of my chin. It was
Wow.
bad. It was not attractive. And came home and the dentist said, okay, you're just going to have to go get this tooth extracted. And he thought it was number 19, the posterior abutment of my bridge. The oral surgeon sectioned it, extracted my tooth. And when the anesthesia wore off, I still had the same toothache. It was the wrong
Mm,
tooth. And so
man.
now I'm missing 9 teeth.
Yeah.
And, so I really have a different value of teeth because they were scarce for me. And so um, I knew that I had to do something about this. I always had medicine like a love for my life because my mom and my brother are both physicians, but I knew that I didn't want to do medicine because my mom was always on call. She's an anesthesiologist, and I knew being a dentist, I could probably have a different lifestyle. And so that was one reason I picked dentistry, but then also it was this experience that put me into dentistry. And the fact that I was also a dental patient all the time, I had a different perspective. So, and I'm Indian, so I had to either be a doctor or a dentist. I really didn't have much of a choice. So that's what got me into dentistry. And then while I was in dental school, number one, I couldn't extract teeth for the life of me. So I knew that I had to learn how to save them.
Yeah.
And again, just wanting to know what my story was, how my story came to be, I picked endo. I gave general dentistry a little bit of a try. I did a GPR after dental school, and then I worked in Manhattan as a GP for a few years. And I knew that I needed something more. I knew I needed to focus just on one discipline of dentistry. And so endo always sung to my heart, and that's how it came to be.
That's how it came to be. So, you mentioned choosing dentistry for its lifestyle. So I want to dive into that a little bit because you're practicing clinically right now. You're
Yes,
running e-school. You're
yes,
married. You have kids. You have
3 of them.
associates. You have staff. So how do you
Yes.
do all of this? How do you do all of this and maintain your sanity, maintain your self-care, a sense of wellness? How do you make this work?
So I am pretty intentional about designing my life. I make sure that I have a good vision for all like 12 categories of my life. And I start to create strategies on how to get there. I knew that being a practicing clinician was not going to be the only thing for me. And that's kind of where e-school came from. I needed to do more. I also know that I need support in order to do that. So I don't say no when people offer me help. We have a big supporting family here. My, uh, my husband's whole family is here. So his parents are here in Charlotte, and his two sisters are here. And they've really been huge with helping, take care of the children. I mean, they're not kidding when they say it takes a village
Yeah,
to raise a child. It really does, and we do have a village, luckily.
that's great.
Or in
Yeah.
my language, we call it a village. So so I have that. I've always had a nanny. I have to have a cleaning lady because that's 8 hours of cleaning that I could be doing
Yes.
something else. So I also am pretty good at outsourcing, and that way I can balance. And over the years, I've gotten better at managing a team to the point where I don't have to be the only one doing everything. I
Right.
can I can rely on my teams to help me get everything done. So I feel like more like I'm a director right now than an implementer. So I'm just a visionary instead of the implementer of my business, of all my businesses, including my home, if you want to call it a
Right.
business.
That's excellent. That's excellent input because I think a lot of people fall into the trap of being the visionary and the implementer because they don't think anybody can do it as good as they can. And so they have a hard time letting certain things go. How have you overcome that mindset? I mean, like, are you
Uh,
okay with like having some things not be exactly how you would have done it?
you kind of have to be okay with that, but you also, it's okay to lay out your expectations. And that's where systems come into play. And so I got really good at identifying what makes me happy and how I like things. And I write it out, and it's written, it's typed out. And so people know my love language because I tell them that. I tell them
Right.
what my love language is. I was almost at the point of burnout at one point. It was about in the beginning of 2016. I was on the verge of burnout, and I realized something had to change. Most of the change had to come from within me inside in order to get the external change that I needed.
Right.
Um, but if I wasn't going to take it seriously on creating a vision, sticking to that vision, sharing that vision, and allowing others to help me achieve that vision, and letting them know that the vision is not just my vision, but it's a way to help them achieve their vision. That was kind of what catapulted all the growth over the last 4 years.
Yeah, that's amazing. So it sounds like in your life, you attribute a lot of your success, whether it's clinically, digitally, or, in your family life, to systems, really what it boils down to is you evaluate what's important to you, the general concept,
Yep.
nail that down, develop a system around it, and then explain it well so that everybody can execute how it's meant to be.
Yep. And then
And
it's life.
go ahead.
Life is automated.
Yeah.
Life is automated. So makes it
Yes.
easy.
Awesome. If you could go back and tell your younger self, that person who was on the verge of burnout, something, what would you say to them?
Start your system sooner.
Yeah.
Start them now. I think one of my biggest weaknesses at the time of that burnout was the way I communicated with others. And if I could tell my younger self just how to relay a message more peacefully, more gracefully, I think that would be number one. Because that was where I really struggled. I had very good intentions, but it just didn't come out of my mouth the right way.
Hmm.
And now I know that, and now I'm free to be that way, but also free to be more vulnerable with people, so they could see when I was stressed out that's why it came out the way that it did, So again, being open, being more vulnerable with everyone, my family, my peers, my team, and also just that in itself, that vulnerability will then help you with the communication. And that's something I wish I learned in my 20s and not in my 40s.
Yeah, I know. It's always interesting to look back and go, oh, I wish I would have done that. That would have saved me a lot of grief. I mean, that's kind of how I feel about, the yoga for dentists thing. I was always practicing yoga, but I was never really like understanding how important it was to take care of myself mentally and physically. So if I could go back, I would say the same thing like, hey, there's more to life than dentistry. You need to figure out how to, communicate what you're needing better, how to even just give it to yourself, even if other people aren't going to give it to you, but how to give it to yourself and what you're really needing and how to pay attention to that. Because, practicing dentistry is stressful enough, and if we're not paying attention to these lifestyle things that we ignore, whether that's communicating or our physical health, mental health, whatnot, it takes its toll. And that's why I think so many dentists end up in burnout,
Yep.
and that's a whole another topic for another day. I mean, we could probably talk for like 6 hours on burnout, but yeah, it's always good to look back and learn from our past and pass on our wisdom to those that are around us. So for you and me, that's the dental community, especially anyone listening or watching today. So I think that's good. I think, the key to having a more enjoyable endodontic part of your practice is to understand the recipe, meaning what is the diagnosis, and then follow the recipe from there regarding treatment and post-op stuff, and having the systems in place so that you can streamline those things, right? I mean, I remember if we had a root canal on our schedule, everybody would be like, oh my gosh, we have to put out like 1,000 little pieces of equipment now. It's not
That's
like,
true.
yeah.
The
So
setup is one thing, right?
yeah, the setup is just one item of stress. So, but again, having a system for that, having a system for the diagnosis and the treatment. So you brought us a wealth of knowledge with just the one word, system, right?
It's my favorite word. It's my favorite word.
Now, I've mentioned eSchool a few times. Can you tell our audience what is involved with eSchool, what someone can expect? And I get a lot of very nice emails from you now that I'm on your mailing list with a lot of great tips. So if you can just give us a little bit of information about that.
Yeah. So first, there's a blog. There's a free blog that you can learn about endo through my tooth stories. That's the way I like to present things, because I think there's just a lot to learn from the case presentations and my kind of spin on it. Those are free. They come weekly. And then with eSchool, there is different ways to learn. There are 3 versions of eSchool. The first one is the independent version where everything's online and you can do everything on your own at your own pace. It's from diagnosis all the way to obturation, post-op care, everything soup to nuts, like complete little mini endo residency packaged up for you. The next way to learn it is the same thing, the same content, but then we can go deeper with coaching. And I offer the coaching of eSchool twice a year. So typically in the beginning of the year and then also in the fall. And this is where we can go deeper into the topics because there's only so much you can put into a video. So I see a lot of value in the coaching because I can really give people clarity on the questions that they have. So I'm actually in it. You get to interact with me. I get to answer your specific questions on your specific cases, give you guidance, give you feedback on how you can improve things for the next time. It's a really awesome community where you can feel very safe to share and make a mistake and learn from it and not feel like you're taken down because of it. It's really every mistake, it becomes a lesson in there. And I think that's really, really important. And then once you complete the coaching, you have the opportunity to do the eSchool Live, which is a live patient hands-on program where people come to my office. I take 5 dentists at a time, and you actually do the endo on live patients, not extracted teeth, although there's a small portion of that, but you actually do the endo in my operatories with my fun stuff and equipment and on a live person, which I think is really the way to learn. And you'll do more root canals in that weekend. You'll get about 4 root canals, which is probably equivalent to most what you have to do in dental school to graduate.
Right. Yeah. Yes.
But I love it because most people don't understand how to do something like warm vertical condensation before the weekend. But then once they're gone, they know how to take that home and use it the very next day.
Right.
So, but I make it so that you have to do the coaching. You can't really do the independent because I don't really know how you're learning in that on your own. You have to do the coaching to do the live. So I know that you understand the concepts because there's just no time in the live weekend to really learn the concepts for the first time. I need 8 weeks of hammering it in, and then we can implement in the live.
Yeah.
So
those are awesome. That's awesome. Yeah. You know, I often wish that, not that I would, but I often wish that I could go back to dental school and relearn everything. Like now that I've practiced for over 20 years, like relearn everything because now you've done it for a while and everything would make so much more sense. It is a lot to cram in. And then, you know, even though I did a residency, I did a 2-year residency and I learned a lot. And I can't believe we don't require residencies for everyone, but it would make sense to, yes, we have CE and whatnot, but it would make sense to go back to the basics at some point in our career and relearn everything and just really cement that in. So I think that's brilliant for you to have the 8 weeks to kind of relearn everything and then hands on. I think that's a fantastic way to make endo less stressful.
I love it.
Dr. Chopra, thank you so much for joining me today and for sharing your wisdom. And thank you really for meeting the need in the dental community for making endo easy for those of us who struggle with it. I love everything you're doing with this program. I love your tips through the email. You have great content on Instagram. So if you're listening and want to follow Dr. Chopra on Instagram, it's at Sonia Chopra, DDS. I'll have all the links for all her resources in the show notes for this episode. And I hope that you will take what you're hearing today, think about it, implement it, and then reach out to Dr. Chopra for some help. Be well, friend.